Strength training can be a little daunting sometimes, but it is so important for our health, especially when it comes to arthritis. Earlier, Claudia caught up with Dr. Kohli to get her take on this.
Well, let's talk about arthritis this morning, because arthritis is something that affects so many people, especially in the knee. Well, Dr. Kohli is the perfect person to guide us and help us through this. How are you, Dr. Kohli?
I'm doing well, Claudia. How are you doing?
I'm doing great. I went to Universal Studios this summer. Everything hurt, by the way. But how common is arthritis, and how do we know when it's arthritis, especially in the knee?
Well, it's funny. We often think of this as an old person's disease, but more and more we're seeing it in younger people. In fact, almost 30% of people after the age of 45 have some sort of arthritis, usually in the knee joint. And it can cause pretty significant problems with functioning, with able to do our sort of day-to-day activity. And this happens because we're probably using our joints more than we've ever used before. A lot of us are into running, into exercise, into a lot of things that put wear and tear onto our joints. And so that means by the time we're in our 60s and 70s, we may be signing up for knee replacements or knee surgeries.
Yeah.
Because once that cartilage goes and you start having bone on bone, there's not much you can do to regrow that, and you end up just having to replace the joint. So preventive measures when it comes to arthritis are really critical.
Oh, when you say bone on bone, that just like makes me already hurt for my poor knees. Who is most at risk for getting knee arthritis?
So as we get older, our joints get older as well, and we lose some of the elasticity in the cartilage. So age is one of the biggest risk factors, but interestingly, women are also higher risk.
Okay.
Yep. If you're obese or carrying extra weight on your body, that puts more stress on the joints, so that can make you higher risk as well. Obviously, if you've had any kind of knee trauma or you're an athlete, you play a lot of competitive sports, that puts more stress on the joint as well. And interestingly, genetics also plays a role in the development of arthritis, because how our joints age is dependent on our genes and our genetics.
Oh my goodness. Yeah. So a lot of it could come from, again, parents or grandparents. My mom had a lot of knee trouble. Of course, she stood up for when she worked for many, many years, but she had to have like the cortisone shots and all kinds of stuff because her knees were really bothering her.
Yeah, and those just sort of treat the symptoms. They don't treat the disease. They help with the inflammation, they help with the pain, but it's not really reversing the condition.
No, you're absolutely right. Knee surgery is next for her, and she's kind of been holding off on that. Yes. Well, there's a new study out about arthritis. Tell us what this study says and what you saw in this.
Yeah, it's a really fascinating study, in fact, and what it tells us is that there is a way to actually reduce the risk of getting arthritis. Now, this is something we never really understood. We sort of always thought it happens naturally, but we're learning more and more that there's a lot of things in our control. So muscle mass and muscle strength around our knee joint determines how much stress is put into the knee. So a lot of people, when they get into an exercise regimen, they start doing weight bearing right away, or they start doing cardio and they start running. But the idea is before you start those, you actually want to strengthen your leg muscles and increase the mass in your legs, the muscle mass, so that you can support your knee a little bit better for those types of activities. So if you do leg strengthening exercises first, before you start doing weight bearing, before you start doing cardio, that's a way to really strengthen the knee. And I really want women to especially pay attention to this, because we're higher risk for arthritis because of the fact that after menopause, our estrogen, progesterone goes away, and that actually changes the way the joint works and the cartilage in the joint works. And our pelvis is wider. So because we have a wider pelvis, because it's designed to hold babies and carry pregnancies, we actually put more stress on our knee joints. So women can have significantly more arthritis than men. So we really need to pay attention.
Yep, us women.
We have it rough.
I'm so happy that you definitely touched on why us women and the reasons why we could be more at risk for knee arthritis. Well, thank you so much, Dr. Kohli, for being with us today. Good to talk to you. And make sure that if you have questions for Dr. Kohli, send them in. She would be more than happy to touch on those. So Dr. Kohli, send your email to mycoco@9news.com and put Kohli in the subject line.